If you're eating all the safe foods, but your belly still blows up like you're 5 months pregnant after every meal, there's a reason no one's told you about. Because what you think is bloating might actually be a gut muscle issue, and it has nothing to do with what you ate and everything to do with how your body is reacting to digestion. Because there's a hidden condition where your abdominal wall and diaphragm, they stop working in sync. And instead of creating space during digestion, your body does the opposite. It pushes out when it should be pulling in. And most doctors don't test for it. I mean, many have never even heard of it. But if you've tried restrictive diets, probiotics, all the gut protocols, and your symptoms still haven't improved, this could be the missing piece. In this video, I'll show you what this condition is, why it causes that frustrating daily distension, and most importantly, how to fix it. My name is Joe Leach, a qualified dietitian and founder of Diet vs. Disease, the world's largest online gut health clinic. I've been teaching about gut health, the low FODMAP diet, SIBO, and all the rest here on YouTube since 2016. And our team has helped people around the world to resolve digestive issues so they can eat freely again, they can travel without fear, and get their lives back. And today we're diving into for some reason, nobody talks about this issue that could explain your stubborn bloating. Let's start with something most people, including a lot of doctors, get wrong. Bloating and distension are not the same thing. Bloating is the feeling of fullness, like there's a balloon inside your gut, but there's no visible change to your body, okay? Distension is when your belly actually expands. You can see it in the mirror. Your waistband tightens. Your posture might even change. You can have one, the other, or both, and knowing which you're experiencing matters because different symptoms point to different root causes. Now, some distension after a big meal, that's totally normal. That's just your body making space for digestion. But if you're seeing major distension after small meals or your stomach expands even when you've eaten what we call safe foods, that's a red flag. It tells us your digestive muscles, especially your diaphragm and abdominal wall, might not be coordinating the way they're supposed to. Now, this condition is called abdominophrenic dyssynergia. And yes, I had to record this scene many times to pronounce it correctly. What a mouthful. And it has nothing to do with what you ate and everything to do with how your body responds during digestion. It doesn't usually show up on its own. In fact, we often see it alongside SIBO, IBS, food intolerances, or pelvic floor dysfunction. But for many people, this is kind of like a missing piece of the puzzle. The one thing nobody has explained to them until now. So now that you understand the difference between bloating and distension, let's take it one step further or one step deeper. Now, one of the expert dietitians on our team, Taylor, she recently did a training on this for our clients on what's supposed to happen in your gut after you eat and what goes wrong when abdominophrenic dyssynergia gets in the way. What a mouthful. So I want to play that 2-minute clip for you now, and then we'll come back here.
So normal abdominal accommodation. So like I had mentioned earlier, we expect a little bit of distension or movement in our digestive area after meals, especially large meals. So typically in normal, and I hate using normal, so maybe I'll say typical. In typical, this is just the terminology used by the American Journal of Gastroenterology. But in normal conditions or typical conditions, the abdominal wall should adapt to that volume increase. So the diaphragm will increase, some of the other organs will shift a little bit, and it elicits what's called an abdominophrenic response due to digestion to prevent distension or that physical expansion. Now, with this, sometimes I don't want to say it's problematic, but sometimes the symptoms can be problematic for individuals. So in abdominal distension, so we won't always feel bloating, but the actual distension, it's produced by a paradoxical contraction of the diaphragm and the anterior wall relaxing. So this anterior wall should kind of move in or pull in to kind of help that digestive process. The diaphragm should move up. Our pelvic floor should still stay strong and not sink down. Again, we're not talking about pelvic floor today, but all of those functions all should domino effect to help with digestion and help also prevent some of that distension. Now, in abdominophrenic dyssynergia, so that's again poor coordination, that word pretty much means the muscles are incoordinated or not adapting properly. So the diaphragm will sometimes actually push down instead of pull up. And when our diaphragm pushes down, we'll also sometimes see either pressure on our abdomen wall, or we'll actually see our abdomen wall push out too. And this isn't just because the diaphragm is pushing out, it's just the muscle's not quite doing what it's supposed to be doing as well. It's kind of like when we hit our knee and all of a sudden we have this automatic kick. Sometimes it'll be like an automatic response that's out of our control, and the muscles will start to do the opposite of what it's supposed to.
So let's break down what Taylor just said. When your digestion is working properly, your diaphragm moves up to make room for your gut to expand, and your abdominal wall gently pulls in to support that process. But with abdominophrenic dyssynergia, those muscles fall out of sync. Your diaphragm pushes down and your abdominal wall fails to engage. So instead of adapting, your belly kind of bulges outward. So let me give you a visual example. Imagine a balloon, okay? Now squeeze it from both sides and the front and the back. The pressure moves upward. That's how digestion should work. Your core adapts and the pressure is controlled. Your diaphragm goes up. But now imagine the top of the balloon has a lid on it. That's your diaphragm, it's pushing down. And the front of the balloon is like soft or weak. That's your abdominal wall relaxing when it shouldn't. So what happens when it's squashed? The only place left for the pressure to go is going to be straightforward through the weak abdominal wall. And that's distension. It's not caused by what you ate. It's caused by your body's muscles reacting the wrong way. Just quickly, if you're watching this and you think like, okay, this is really speaking to me, I have this issue and I would like help, make sure you check out the first link in the description, or you can comment Sure Pathway and I can send you more details, because what that link is it shows you what our signature For Sure Pathway approach is to helping people with gut issues. Okay, so what if this is what's happening in your body? What can you actually do about it? There are a couple of approaches that help retrain these misfiring muscles and improve coordination. So number one is physical therapy, also known as physiotherapy, depending where you are in the world. Now, working with a pelvic floor physical therapist can make a huge difference, not just for pelvic issues, but for the way your abdominal wall and diaphragm coordinate. Now, these therapists are trained to assess and retrain the reflexes involved in digestion. The second option is diaphragmatic breathing. Now, this one's more powerful than it sounds, I suppose, but only if done correctly and consistently, okay? We're talking 5 to 10 minutes before meals and like 20 to 30 minutes after meals or during flare-ups. Now, the goal here isn't short-term relief. It's to retrain your diaphragm to expand and release fully. And you might be thinking like, I already know how to breathe properly. Well, the reality is the majority of people don't actually breathe properly. Their breathing is shallow or braced. And this is why working with a specialist, even just once, can be a game changer. Now, what about diet? Reducing FODMAPs or intolerances can help by decreasing the amount of gas produced, which reduces the workload of your gut muscles. But to be clear, I mean, that's symptom management. That's not root cause resolution. It might ease the pressure, but it won't fix the muscle coordination issue that's causing the distension, right? Now, at this point, you might be wondering, well, can I treat this myself at home? Let's go back to Taylor one last time, where she answers that exact question.
Yeah, so it can sometimes be treated or managed on our own through diaphragmatic breathing consistently. That can be one of the best treatment options for fully resolving or retraining our diaphragm, as long as we're doing it properly. And that's what sometimes physical therapists say they notice is people are perceiving that they're completing the diaphragmatic breathing properly. They've been doing it for years, they say. And then when the physical therapist has them actually do it in office with them palpating, they notice that the diaphragm isn't actually properly contracting and releasing. And so they've actually been exacerbating the problem because they've been diaphragmatically breathing improperly consistently for a long time. And so I would say, yes, you can potentially treat it on your own, but only if you are fairly confident you're completing some of the strategies properly, I would say.
So yes, this condition can improve at home, especially with the right breathing and coordination strategies. But here's the thing, many people try to self-treat thinking they're doing it right, when in reality they're unknowingly reinforcing the problem. That's why a single session with a gut-savvy physical therapist can be a game changer. And the rest, that's where we come in. Our team helps you figure out whether your bloating and distension are caused by a muscle issue, a bacterial imbalance like SIBO, a food intolerance, or even a gut-brain dysfunction that no test can measure. From there, we guide you step by step using expert testing, nutrition, and gut-directed therapy, so you're not guessing anymore. In fact, one of the first things we do is help you determine if you even need a physical therapist or if your symptoms are being driven by something else entirely. If you'd like to learn more about our signature program and the For Sure pathway we use that makes it so effective, click link number 1 in the description or comment Sure pathway below and we'll send you all the details. And if you're earlier in your journey, grab our free low FODMAP food list using link number 2. Lastly, if you're wondering whether something like SIBO, small intestinal bacterial overgrowth, could be behind your symptoms, especially if bloating is a daily battle, watch this next video where we break down SIBO testing, treatment, and the key signs to look for.